Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. A method of identifying Alzheimer's disease based on substances present in the blood, as well as clinical factors such as age and sex, can be used to accurately identify those with Alzheimer's disease, according to research published in the Archives of Neurology. Currently, Alzheimer's disease is usually diagnosed based on a medical history and physical examination, neuropsychological testing, and brain imaging studies. Researchers from Texas Tech University Health Sciences Center measured the levels of several different substances present in blood samples of nearly 200 individuals with Alzheimer's disease and 203 individuals without the condition. They then conducted statistical analyses to determine whether, taken together, the presence and levels of these biomarkers could predict which individuals had the disease. These biomarkers included substances involved in the clotting of blood, immune system functioning, and inflammation. Together, a risk score based on the biomarkers as well as patients' age, sex, education, and the presence of genetic factors associated with Alzheimer's disease was able to correctly identify 94% of those with Alzheimer's disease. It was also able to correctly classify 84% of participants as not having the disease. We spoke with Dr. Sid O'Brien, one of the investigators of this study, who offered some further insight.
But basically what we've done is shown that we can take blood tests and we can measure a whole range of things in the blood and then ask a few simple questions. And by doing that, we can come up with a diagnosis that is incredibly accurate. As a matter of fact, it's as accurate as all of the state-of-the-art methods at this point. The nice thing about this is why we're so excited is because of increased access to care. A blood test opens up access to patients anywhere, anytime, a rapid, reliable, and cost-effective means of getting a test for Alzheimer's disease so that treatments can be implemented as quickly as possible early in the disease. At this point, it's just diagnostics, but we're planning on doing a whole lot more with it in hopes of maybe predicting risk, predicting progression, but we are still moving forward on the project. We're going to cross-validate it, and hopefully in the next few years it'll be something that's ready that patients can go and ask their primary care physicians about.
Today's research provides a potential new, easy-to-use tool for identifying Alzheimer's disease. The preponderance of relevant biomarkers related to inflammation in the algorithm also suggests that targeting inflammation may also be a useful way to combat the disease. For Insider Medicine in Depth, I'm Dr. Susan Sharma.